Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of three. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Hi, everyone. Thank you so much for joining us. I have a very special guest today, Stephen Irshay, and I'm excited to be talking about anxiety and depression and how it pertains to the new generation, specifically through technology and social media. So, Stephen, thank you so much for being here with me.
It's a pleasure.
Would you mind telling everybody a little bit about yourself?
Oh, I'd be glad to. Well, I will anyway. About myself, I've been a practicing therapist for many years now. I was trained as a family systems therapist. I'm also trained as a psychoanalyst. And in my past, in order to put myself through school, I taught everything from kindergarten to 12th grade and also college level courses in graduate school. And once owned a school for kids with behavioral and emotional problems for 27 years, and always while doing therapy. So that's my main focus, doing therapy, and that's all I do now. I have 2 offices and just love what I'm doing and don't ever plan to retire.
Oh, great. I don't know how you can deal with listening to all of our problems, but glad to know that you will always be there, not retiring.
Well, I'm not.
Okay, good. So today's topic is very close to home for me. I'm sure it's close to home to a lot of people in this generation. I'm a little bit old school because I'm older, but I have younger children and I have nieces that are very much into technology. It seems like they're glued to their phone, specifically social media, Instagram, TikTok, Snapchat. And I've noticed that there has been a rise in trend with anxiety, depression, suicide rates. In fact, I have some staggering statistics. I read that 31.1% of U.S. adults experience anxiety every year. They have anxiety disorder. And approximately 29% of U.S. adults in 2023 have been diagnosed with depression. But as you and I had talked about, that's only adults that have actually sought out help.
Those are only the reported people.
That's right.
That's right.
And one other interesting statistic I read was that suicide rates in the U.S. have increased 35% from 2000 to 2018. That's a staggering number.
Sure, it certainly is, and it speaks to the anxiety and depression that is endemic nowadays. Mm-hmm. One thing I want to point out, which is really interesting because you've brought up social media and the young people who are doing it, and you're old school, and I'm older school, okay?
That's right.
Is that in terms of depression, believe it or not, people as they get older, there's less depression symptoms in older people than we have in younger people today.
Now, why is that?
I think because they're not as glued to their phones and devices and still have more social connections because we were brought up that way, because we're social animals to have connectedness with people. We've been brought up to have eyeball to eyeball and shoulder to shoulder contact, not something in our hands that gives us neurotransmitters, dopamine, serotonin, norepinephrine, but getting it from experience with other people. And there's a lack of that going on right now.
Yeah, I noticed that quite often. An example would be when I'm having a dinner date with Matt, for example. One of the things I notice, and it's shocking, is I'll notice other couples or families that are also having dinner and nobody's talking to each other. They are literally glued to their iPads, to their phones, and it's almost like they're a bunch of robots just sitting there for purposes of eating, but nobody, like you said, is connecting.
They're not there with one another, and people aren't feeling the connectedness. And in a way, the tail end of that is that without the connectedness, you feel the idea or the feeling of abandonment and rejection because you're not connected to another person. And for instance, when I came in here today, the first thing I did was turn off my phones and put them some other place so they don't get between the two of us. And devices are getting between people today with all sorts of unintended damage, but damage nonetheless.
Yes. I mean, with kids, I see very young kids with iPads all day, every day for hours at a time. I mean, it's sad. Even with my own family, I see my nieces, my nephew, they're glued to their devices.
And try and take it away.
I wouldn't even dare.
Okay.
And it is sad for me because at that age, I remember when technology, even just cell phones, I was in a time where we had pagers in high school and you couldn't really communicate too well. There was, you could text a few words. And then cell phones came out maybe around, I don't know, when I was a sophomore or junior in high school. And even then, I felt there was the connectedness because we didn't have social media. We didn't have the internet so readily available on the phones.
You're correct.
And I could pick up the phone and speak to someone. And even when I would meet with friends or family, the phone was used to bring us together. But when we were present, we were still having that connectedness. And
you weren't instant messaging or sending texts back and forth across a table.
Yes. And I actually sometimes find that when text messaging became very popular, that was the start of the disconnectedness, because instead of picking up the phone and talking, even if it was for 30 seconds or a minute, now we can communicate with 20 different people, get our one text sent out. And that started leading and prepping us, I feel, for even more disconnectedness.
There are a number of authors who can go back in time to when there was unlimited data and unlimited texting, and that's when anxiety and depression levels in adolescence started spiking up. You can tie it to that.
That's crazy.
But again, that's the great disconnect from other people. And we need other people. We're social animals. Without that, we don't know how to engage in life. And then when something happens, it becomes overwhelming because we don't have the experience in dealing with something. We don't have that eyeball to eyeball, shoulder to shoulder kind of experience with people.
Yeah, we're a lot more fragile nowadays. Oh. We're wrapped in bubble wrap.
That's right. You're talking about kids, your child, their age, my grandchildren's age. At that age, back in the old days, we were playing outside unattended by people, not watched. We were in the front yard playing by ourselves. Mm-hmm. You don't see, if that happened now, somebody would call children's services if there was a 5-year-old playing in the front by themselves.
Yeah. Yeah, that's actually true.
And in a way, it's necessary to wind up with a skinned knee to find out what the world's like. Mm-hmm. But again, we're bubble. This is another problem, the bubble wrapping of our kids.
Is that the same as gentle parenting? Because that phrase has been thrown around a lot at my children's school, and I don't exactly know what that is.
You're right. That's kind of what it is. It's taking a beat, but protecting your child from encountering the world as the world exists. And what could be better than finding out what the world's like so you have experience going forward?
Yeah, that's right. We're not contributing if we're parenting that way to giving them independence and learning how to survive.
There's an old Russian proverb: you teach your children to walk so they can walk away from you.
Oh, I want them to stay, but I still want to teach them how to be independent.
That's right. You want them to be able to be independent on their own and take care of themselves. That's right. And then the next generation, your grandchildren, you want your children to be able to be good parents to your grandchildren.
Mm-hmm. So this anxiety and depression pandemic, we'll say, is something that has also been a topic at my children's school where they've been very supportive in bringing in specialists to talk about the effects of social media when it comes to cyberbullying or having children that are, like we had talked about, very addicted and glued to their screens, or maybe feeling more insecure, which again could lead to that anxiety, depression, because they are getting the best versions of what's in social media, which is not a reality, a depiction of reality.
They're getting a curated version of what the world is like, and it's incorrect. It's again, a supermodel vision of what a woman should look like, which is not the case. That's untrue. That we can't do that, but we see that, and it gets shown to them over and over again. The repetition of it is amazing, and it comes in those 15-second, 30-second bites, and you just keep scrolling and scrolling and scrolling. And I see adults doing that too.
So I want to talk about a few things with that. The scrolling and the shorts that are so popular right now, how is that affecting children and young adults and even adults? How is that affecting their brain? Is it increasing dopamine? How is that affecting them? And why are we wanting to continue scrolling through all of these shorts? And it's like information overload.
Well, in a way, a phone is a dopamine delivery system. It's pure and simple. The people that put sites up have figured out, with algorithms, how to keep somebody engaged and looking. And they'll keep looking and looking. And the more dopamine you get, the more dopamine you want. And you don't want to have a dopamine drop and not have dopamine in your system.
So you continue doing it.
That's right. And it sets you up to where if you're sitting in a classroom in front of a teacher, you have a hard time listening to that because it's not nearly as...
It's boring.
It's not nearly as exciting as a 15-second video.
So this is all really beyond the anxiety and depression, just permeating into all sorts of negativity, like maybe ADHD. It's contributing to these other types of diagnoses.
I have no doubt that because I see that coming into my office regularly.
So how old are these children or patients or teenagers that you're seeing that are exhibiting symptoms of anxiety, depression?
A lot of adolescents, typically young boys for some reason, more boys than young women. And they come in and they are anxious and somewhat depressed. And part of it has to do with their own self-esteem, self-worth. I see some really good-looking kids worrying about what they look like to the rest of the world because they don't look good enough to themselves based upon the videos they're looking at.
Yeah, the pseudo-reality.
Yeah, and yes, and it's a reality in 2-dimension, not 3-dimension, and it's on a little screen. It's debilitating to them.
It is. It's really sad. It's really sad. With regards to, again, this comparison that younger children are having to think that, like you had mentioned before, these supermodels are normal. This is what we should look like. This is how our life should be, maybe even. We should be driving nice cars and traveling the world. And, this is what I do every day. Let's say these are the posts that I see.
And you can't, when you start comparing yourself to that, you're always going to come up short because all that has been curated. Again, I always use the example of my avocado toast will never be as good as your avocado toast. So now I'm going down a rabbit hole of feeling bad about my avocado toast.
Yeah, because yours is right in front of you and the one that is on Instagram looks so much better.
Because they spent 45 minutes putting it together and lighting it correctly. And it leads to this, like you say, FOMO, but also I am not as good as, which is a terrible rabbit hole to go down, because it then goes into other areas too. Not only don't I have that as good as what you have, I'm not as good as you. I'm not as smart as you. I won't do as well as you. And then the anxiety, again, my best definition of anxiety is continually rehearsing for something in the future that may or may not happen.
Yes, it's that anticipation.
Right, which is different than a fear, which makes more sense, because a fear is right in front of you and you deal with it. This is the anxiety of thinking about something in the future that may or may not happen. If I can give you an example, if you're planning on going to the Grand Canyon later this month, if you're standing on the edge of the Grand Canyon, what are you worried about?
Falling down.
Okay. If you are thinking about falling right now into the Grand Canyon, that's anxiety. And here's how it works. Once you face that fear, if you should fall, you're no longer worried about falling, are you?
No.
Okay. So you can have anxiety here ahead of time, and it can drive a person crazy because it takes up so much space and it takes you away from other people.
Yes. Adding to more disconnectedness.
That's right. Mm-hmm.
And heightened levels of anxiety and possibly depression.
Depression comes when the burden of anxiety is so much that you've withdrawn from life and it doesn't taste good anymore, and you're just too burdened and you want to be off.
I want to go back to social media and cyberbullying, because these are things that I never had to deal with. You never had to deal with. And I remember growing up and also kind of talking about feeling not good enough or not knowing who you are. These are challenges that we have to deal with as humans anyways, in our own development, in our own personal development.
That's right.
And that to me was a challenge in itself, not having the distractions of technology, social media. So I cannot imagine what the younger generation is dealing with and how much more amplified having to figure out who they are with all of these other distractions.
You're right. And again, it's amplified, but it's not amplified in front of you. Back in the day, if we had to deal with bullies, they were in front of us, they were in school, they were sitting next to us, they were on the playground. It was a person that was there with you. Now a cyberbully comes through a phone. What can you do about it? It's impersonal. And there's nothing.
But you're taking it personal.
Oh, absolutely.
Right? It's
impersonal in that it's not face to face. It's not a connected interaction. But on a phone, what do you do about it? And it's there forever, and it's there for everyone to see.
And there could be multiple cyberbullies, which amplifies those emotions of feeling less than.
Less than. And then for a lot of kids, young people that I see, and even adults, shame. And the best definition I can come up with is shame is that feeling you get of other people looking at the back of your head for something you did or didn't do, that it wasn't right in their eyes, or some way you didn't measure up. And that's a debilitating feeling.
This is it, the more and more we have this conversation, I just, it really, and I love, I love technology. I think technology has served us well.
Absolutely.
It is here to stay forever. And, what I'd like to learn more about, especially being a parent, is how I can live in this world where technology exists, but I'm still protecting my children, so that they're not completely influenced by all of these things we've talked about, and or shielded in a way, not bubble wrapped, but shielded from maybe cyberbullying or fear of missing out. How I can minimize those emotions now. They're only 6.5 and 4, but I think now is the time to start.
You're absolutely correct. And again, one great way to start is, first of all, showing them an alternative, that you as a parent are not on the phone all the time.
Yeah, we have to teach them by doing.
Yeah, not by telling them, by doing it. Because if you tell them not to do it, but you're doing it, they're not going to believe you, and they're going to do it anyway. Okay. The other thing is to get them to talk about what they feel and what's going on, and spend time being connected with them. Because the more time that they spend being connected, the less time they have to be on a phone.
That's true. That's actually very, very true. Just
Yeah,
these are basics.
If you spend time with your child going someplace, doing something, they're not going to be on the phone.
Mm-hmm. They won't be bored.
Or if they're out playing, they won't be on the phone.
I think one of the things that's very interesting as parents is I know a lot of parents that have these concerns for their children, and yet I'm not sure many of them are aware of their own personal addiction with technology. And like you had mentioned, there's no way we're going to be able to tell our children not to do something.
That's right.
While we're doing that.
Yeah, and we can't say to them, well, I need the phone for work. No, if you have a phone and you're paying attention to that, you're not paying attention to your child.
And that leads to also anxiety again.
Absolutely. A lack of connectedness, a lack of the child being able to see the parent as a good object that helps them to feel better about themselves, helps them to explore the world. They're not there. They're on their phone.
And that message, which I can only imagine, because I grew up with parents that were very present to me, where we were very connected, the family as a whole. But that message to that child that is not being responded to or having attention is that whatever's going on in their phone is more important.
That's right. What I have here is more important than you. And that is a killer thing for a child to feel, because a child wants to be cherished and appreciated and affirmed by a parent. Yeah. And if a phone is more important, that is a blow to one's self-esteem.
Yes, and I imagine the same for spouses, the same for everybody.
Absolutely. An analyst by the name of Winnicott had a wonderful quote. It was, it's a pleasure to be lost, but a tragedy not to be found. And again, when you're staring at a phone and you have family members around you, they're not being found.
Yeah,
they're lost.
That's really sad.
They're not being found.
Now, I kind of want to go down the topic of therapy, and because I believe so much in therapy, and maybe some of the stigmas that I know exist still, because with all of this anxiety, depression, and technology, social media contributing to this disconnectedness, I would imagine that therapy is even more important now. And I still talk to people about therapy and feel that there's a stigma around that.
That's definitely still true.
And why do you think that is?
Well, people sometimes don't want to acknowledge that something could be wrong. They don't want to know that sometimes things are bigger than we are, and some people would like to believe no matter what, you should be able to handle everything, which is not true. Sometimes things are insurmountable, and things are complex, and many people lack somebody who hears and sees them and are curious about their lives. And without that, you can really go down an anxious and depressed hole if you're not connected to somebody.
Yeah, and given everything we've spoken about now, it's more prevalent that we should seek out these therapists.
And a therapist, to me, a good therapist is somebody who has empathic curiosity about your world. Like, tell me more about your life. I want to know more about it, and I want to know about it without commenting on it, that it's a negative or a bad thing. I want to know how your life makes sense to you.
Mhm. So I grew up, I'm Filipino, first generation, and there was no such thing as therapy. We could handle it all, as you had
Of course.
mentioned. And for me, I think one of the most humbling things is really just acknowledging that that mental health is very important. There's a lot of emphasis on physical health and why we should eat this and why we should go to the gym. And mental health just kind of fell by the wayside.
It certainly has, and we give it short shrift. Like you say, it's not that as important as physical health, but our emotional health, in a way, is connected to our physical health because we embody what we go through. We embody our experiences. They are contained within us, and we act them out at times.
Yeah, I agree with that. And I can also see why people might not want to go to therapy, as you had mentioned, because they don't feel something is wrong. Maybe they haven't hit rock bottom, or they feel too hopeless that maybe nobody could help them. And that's the saddest thing. So one of the messages that I'd like our viewers to take from this is that it's never too late.
Oh no, I have a number of patients, a couple people that I see in their 60s and some people in their 70s and 80s, and are getting a benefit from it, from saying things out loud to another person that they haven't really understood or been able to say to anybody else, and now they sense them and feel them in a different way, and they're not as burdened by them.
Because once you get that thought out and you can hear yourself, there is a different perception sometimes.
You look at it in a different way. For instance, whatever events we have gone through, they are in us. We have them. They're not even unconscious. They're preconscious. They're ready to come out. And when somebody's curious, they can bring that out and find out that something that's been important to somebody that's been overlooked. And then you go, that's why this is going on. This is what I can do. This is how I can look at something in a different way.
Now, what is your take on antidepressants or anxiety medication? Do you feel that they're important to have in addition to therapy? Just what's your take on that?
There's no reason for a person to struggle if they don't have to. And sometimes psychogenics, mood stabilizers are, really a good thing to throw into the mix. And the research shows that medicine works, therapy works, medicine and therapy together work even better. That's what research shows.
Yeah. Yeah, I think it's important too, because is it true that anxiety for a prolonged period of time, which turns into depression, changes the brain chemistry?
It does, and it brings creates cortisol going through your system, inflammation. Yeah, your brain chemistry changes. You're right.
I don't really have anything else that I'd like to add. Is there something that we haven't covered that maybe you'd like to add to this?
Okay, yes. In terms of psychoanalysis, which is mostly what I practice, I would call it like a depth psychology. It's different than counseling, where somebody comes in and just talks about a problem they have, and in a way, sometimes you try and fix it. Mm-hmm. We don't do that. What we want to do is something that has more depth, which is that there are experiences that a person has had that they may or may not know about, and that impact their life in the present. And we seek to get at those things and bring them out both in a relational way. And I've talked to you before about organizing principles. Yes. And organizing principles are the way in which we choose to live our lives, all the decisions we make, what we're used to, how we relate to other people. And they're all based upon early relational experiences. And sometimes we don't know how those organizing principles were formed. And it's very helpful to find out that, say, for instance, I have this thing where if my wife says, Stephen,
Uh-oh.
Exactly. Even though she's just saying my name, but back in the day, parents and teachers who said that had a different meaning than just calling me for my attention. So in a way, that's an organizing principle that I have that's based on a number of early relational experiences. And by knowing that, I get a chance not to relive that in the moment when my wife's calling my name.
Because in that tone.
She may not say it that way, but because of my organizing principle, I'm hearing it that way.
I understand. So would you say that psychoanalysis appeals more to the subconscious brain? Is that what
we
we're
try
discussing?
and bring that, the unthought knowns out into the known world.
I understand.
And that way, we don't trip on those things in the present. In other words, I won't then respond to my wife as if she's one of my older teachers or my parents, which is a good thing because that would not be good for my marriage.
No, I understand. So a lot of the behaviors that we might have are reactions.
Absolutely. They go in brain speak, they go into the amygdala, which is fear or anger, and there's no self-reflection in the amygdala. We just act out of fear and anger. And fear is a big one, and fear is related to hurt.
Mm-hmm. And one of the ways that psychoanalysts approach that is by, like you said, relational and kind of going back into your past and questioning why did you get such a heightened reaction?
That's right. And we can do that in what we call an intersubjective way too, in the present. For instance, if something happens between a patient and myself, and they have a response to it, what does that remind you of? What does that feel like? What's that reflective of? Can you think of a time when it felt like that before? And then suddenly things emerge that become freeing.
Yeah, that makes sense. So what are maybe 3 takeaways before we end that you'd like to tell everyone on how we can address anxiety, depression, and maybe reduce the exposure to things that could cause those emotions? What are some of the things? 3 things.
Well, one thing is to what I call cover the brake pedal. Slow down and ask yourself, what am I experiencing right now in this moment? Even with anxiety, there's something else. What is this? Try and locate it in your body. What is this feeling trying to tell me about my life at this very moment? And then another thing is, along with that, to do a danger analysis. What is the danger in feeling this right now? Really, what is the danger to me? And go through it and answer each question and continue going down that path. And then you'll see really what is the danger. For instance, back to the analogy of you going to the Grand Canyon. What's the danger right now of feeling anxious about falling into the Grand Canyon as you sit here today?
There's no danger, no real danger.
But if you don't mentalize that and think about it, you continue to feel the anxiety.
And hold it.
And it just keeps boiling. So the thing is to cover a brake pedal, stop and think, what do I have here in front of me right now? And then also do a danger analysis. And then the last thing that I suggest to people is what I'm about to do, say, or think. Is it my best interest? Is it ultimately in my best interest? And if you can say yes to that, have at it. If you can't say yes to that, rethink it.
Okay, that's some really great advice.
And easier said than done.
Yeah.
But again, it has to be practiced.
Yes.
These things have to, like I was saying, you might have to go around, the bus might have to go around the block another couple times.
And I think that these are the benefits of therapy too, is being able to reflect, having someone else reflect and giving us these tools of what we can work on.
Absolutely. Somebody else who is interested in your life, who shows curiosity, who wants to get, tell me about that. Let's go into it even more. And in doing that, you uncover more good information. And information is power, and power is optimism.
I agree.
Yeah.
So I've learned so much in this session, and I have a lot to think about as a parent with making sure that my phone is away when I'm with my kids. I think I do a pretty good job, but really just emphasizing that within myself and making sure that my kids are out more and doing things how we did it when we were younger.
Have, again, the eyeball to eyeball, shoulder to shoulder experiences with other people. It is so important.
Yeah.
That's how we know how to get through life. That's how we know how to manage things, how we relate to other people, not from a thing we hold in our hand.
I agree. Stephen, and for any of our viewers who'd like to find you, do you have a website?
I'm on one website called South Bay Psychology Specialists.
Okay, specialist with an S.
Yes, I have 2 offices. I have one in Westlake Village and one in Manhattan Beach.
Okay, great.
Mm-hmm. And I see people of all ages above the age of 16.
Well, thank you so much, Stephen.
My pleasure.
Joining me.
Very nice. Thank you.
This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.